Remove all the cells represented with the facial features is actually a triangular space, the group of cells that are present lateral to the vertical part of the facial hair. This is bounded actually. Now, before we actually explore the facial features, the first thing is we need to scrutinize the facial line. That means we have to identify the shadow of the facial line. So that's what I am trying to do now. Already facial features is getting open here. Now let us identify the landmarks here. So, facial features is a triangular space bounded medially by the descending part of the facial hair, upper half of the descending part of the facial hair. This is the medial boundary. Lateral boundary is tympanic annulus. Superiorly it is bounded with fossa. So now, at this point, if I open, I will be entering into the facial features. So, facial features is a triangular area bounded medially by the upper half of the vertical portion of the facial hair, superiorly by fossa inferior, laterally by tympanic annulus or paratympanic. So now this is the area fossa inferior. Now, so before you actually open the fossa inferior facial features, we find a cell. That is called as here is a patient that has a very narrow or serous macroid. We have a cell that is present here. That is called the Herald cell. So that will take you to the facial features. So Herald cell is present in the facial features where you can open that. But only thing is the structures that can get damaged when you do facial features is facial, nerve and tympanic annulus. So always you should leave a part of the bone in relation to the fossa inferior so that your birth will not touch the. Only thing is your birth should not touch the incus. So you leave a small part of the bone there. That is called a incus buttress, which actually it is not present in the human body. Manufactured to leave a small piece of bone here. This is called a incus buttress. So now I am slowly opening into the. Only thing is you should not create a complication here. The biggest trouble here is to you need to be very careful about the facial line. So this is a commonly done technique in the cochlear implant. We have posted it around. So this procedure earlier was done for removal of cholesteatoma, but today it is not done because we have better procedure. So this is usually this procedure is reserved for cochlear implant. So now I am just opening there. 1 mm diamond bar. What you will see when you open the posterior. the inferior joint stapes superstructure. Here already we have removed the stapes superstructure. You will not see that because we have done a complete stapes surgery. So you will be seeing the footplate only. That is the only. That is the posterior anatomy. Otherwise, you would have seen the stapes super. This is the footplate here. This is the pyramid. This is the incus buttress. You see the fossa impedus and the facial nerve and tympanic angle. So this is called as facial meniscus approach, commonly done for. So now you tell me, madam, what are the boundaries of facial meniscus? Very good. Yeah. Superiorly? Very good. Fossa impedus. So now this is the jugular bulgaria. This is the digastric ridge, lateral groove, medial groove. This is the sigmoid sinus, central angle. This is the. So now once we do this, so I will show you. Next is the endolymphatic sac. So this endolymphatic sac, where it is present actually? It is present in the posterior fossa dura.